any woman after they deliver, whether you're a strong woman or you feel that you were not emotionally strong before, or anybody can get postnatal depression. And the most important thing is to recognize the early signs, just so that you can get help early.
Absolutely. In fact, 10 to 15% of women can actually get depression within the first year postnatally after they deliver. And in fact, 10% of fathers can also get postnatal depression.
Oh, right.
Yeah, so actually fathers can also get postnatal depression.
They just don't talk about it, right? Yeah.
But because I think basically our society doesn't even know about it, right? And without the education, without identifying the signs, it's sometimes left untreated, and it doesn't go away if it's untreated, because it's very different from baby blues. Baby blues is really normal, the first weeks, particularly the first couple of days post-delivery. I actually remember when I had my baby, my doctor actually did a lot of screening to ask me if I had postnatal depression. Remember I told you this, right?
Yes.
Because my baby arrived and I didn't cry from joy. I wasn't filled with love yet, because it took me a while to
bond
recognize and bond the baby, and I was in so much pain. I didn't have enough support. I didn't actually have good physical help, practical help at that time, and I had a lot of too much bleeding, a lot of pain and all that, and they insisted that I was depressed, and I'm like, no, I'm not, this is baby blues. It's really normal. And they're like, yeah, but you're a psychologist, you will say that. I'm like, no, I am fine. And it takes time to bond with the baby. And after a week, when I got a little bit of sleep, I got a little bit more support, I wasn't so much in pain, I went back to my own environment, then the mood felt better, my appetite was better, I wasn't so teary, so irritable. But that's really normal. I think sometimes new moms come in, they don't know, and they think that that's postnatal depression. But sometimes just letting them know that it's really normal, you're hormonal, there's so many changes to your personal life, new addition of a younger sibling or first baby, it itself is overwhelming.
I think you're right about that. I mean, trying to distinguish between baby blues and postnatal depression sometimes can be really difficult as well. But then if you realize after about a week or so that this feeling that you're having, sometimes you're just crying for no apparent reason, or you don't really, some women say that, they don't feel that they're bonding with the child. If this continues on for longer than a week, I mean, it's not just you that realizing it, sometimes you don't realize it, but it is important for your partner or your family around you to realize that as well. And that's also important why you should actually come for your postnatal checkup when your obstetrician or your doctor say that, after about 5 weeks, 6 weeks, please come over. Because one of the most important thing that we do after a woman's deliver, when we actually see them again, is to assess for postnatal depression, because sometimes you don't realize that you have it. And there's a lot of ways that doctors can actually help to assess whether you do have postnatal depression, because the important thing is to diagnose it early, because if we can diagnose it early, then we can actually treat it earlier for the mother as well.
So I suppose some signs for new moms to look out, even new dads to look out, would be probably mood changes, they might be a bit more teary, or even just getting frustrated or more irritable easily, changes in appetite and sleep, maybe they find that they cannot eat at all, or they're just binge eating. Same thing with the sleep, sleeping a lot or not sleeping at all. Or they have feelings of guilt that they believe that they don't love the baby and something is defective with them, or they start to withdraw from family members and friends and they don't really want to interact with people. Any of these signs and symptoms, if it's happening every day, almost every day for at least 2 weeks, that's the point that they must go and see a psychologist or a doctor to get themselves properly diagnosed. And there are many treatment methods. So psychologically, sometimes we use cognitive behavior therapy. So basically, that's challenging the way that they think, because the way you think about things affect the way that you feel and the way that you react. And if they think that, oh, I don't love my baby, or I'm a bad mom because I cannot breastfeed, or I cannot bond with the baby, or I don't feel that I love the baby at that point, I think that those are really very, very scary thoughts to
Very
have.
concerning. You have to be concerned about these kind of thoughts, and you have to be open to actually seek medical advice. I mean, it's something that not a lot of women or not a lot of society acknowledge, that these are normal feelings, and postnatal depression is common, and it's not something to be ashamed about. It can happen to any woman, and the main thing is to recognize the sign and then be willing to actually seek medical advice.
And it's highly treatable.
It's highly treatable. Yeah.
And I often tell my new moms, right, you think about your situation. You have a new baby, and then sometimes maybe your parents or in-law pop by anytime they want while you are trying to breastfeed. You're not probably dressed properly. You don't have enough sleep because you're up either pumping or feeding. You're trying to look after a newborn who is completely dependent on you. Everybody has a different belief or practice. I mean, you're trying to kind of toggle with all of them. You got physical changes, everywhere pain, top pain, bottom pain, everywhere pain, and you're tired. I'm sure a lot of mothers go through this, and I think a very big differentiating factor is how much help and support and understanding you get from your loved ones. And sometimes we are blessed, right? We get them, and then it can be a more supportive journey. And sometimes, unfortunately, particularly when it was COVID, right, it was difficult to get the kind of support that we would otherwise have had. So there's really no shame in seeking help when we need to get them.
Yeah.